Macrocytic anemia or megaloblastic anemia happens because of the decrease of folic acid or B12, and this happens due to metabolic error or defect that leads to inadequate biosynthesis of thymidine. Thymidine is one of the building blocks of DNA. Thymidine decrease will lead to a decrease in DNA replication. Macrocytic anemia is caused by a deficiency in B12 or folic acid. B12 deficiency is caused by insufficient diet, which occurs usually in strict vegans. Now, the second most important cause is malabsorption diseases such as celiac disease, and we have pernicious anemia. Pernicious anemia, which is an autoimmune disease caused by the atrophy of gastric mucosa. Finally, we have metabolism error. Vitamin B12 is transported to bone marrow and other tissues by transcobalamin 2, so a deficiency in this glycoprotein causes B12 deficiency. Causes of folic acid deficiency. As B12 deficiency, folic acid deficiency is going to be caused by insufficient diet, especially in strict vegans. The second cause is malabsorption. One of the most important malabsorption disease is celiac disease. Now, the third cause are drugs. Drugs such as phenytoin and the cytotoxic drug methotrexate causes folic acid deficiency. Now, finally, an increase in folate requirements, such as in pregnancy or in growing, is gonna cause folic acid deficiency. Clinical features of patient with macrocytic anemia. This patient is gonna look pale and tired. Patient suffering from macrocytic anemia is gonna look pale. He's gonna also look weak. He will be tired on exertion. Fetus suffering from the disease will have poor feeding and weak suckling. Finally, and this is an important characteristic, which is red huge beefy tongue. Macrocytic anemia investigation is going to show an increase in both levels of MCH and MCV, usually greater than 120. Peripheral blood films shows macrovalocytes. So on investigating peripheral blood films, we're gonna see large ovulocytes and biochitocytosis. Patient bone marrow should also be investigated. On bone marrow examination, we're gonna find a large precursors of both erythroid and myeloid cells. Erythroid and myeloid cells are gonna be huge. Finally, we're gonna have a decrease in the serum level of folic acid or in B12. So a decrease in the serum level of folate level or B12 is noticed. Now I'm gonna talk about treatment of patient of macrocytic anemia. If a patient with severe megaloblastic anemia requires treatment before vitamin B12 or red cell folate results are available, both B12 and folic acid is given to this patient. However, Folic acid therapy alone in the presence of vitamin B12 deficiency may result in worsening of neurological defects.